Afternoon. Welcome, dear participants, esteemed colleagues, to this first webinar on the Pan-African Conference on Environment, Climate Change, and Health, where we are exploring the science to policy nexus. My name is Leah Aoko Otieno. I'm going to be your lead moderator throughout the sessions, and I take this opportunity to welcome each and every one of us to the discussions today. We look forward to useful insights as we gear ahead to our main conference. So at this point, I'd like to just set down some housekeeping rules. Kindly, if you do not have the floor, maintain your settings on mute, and your video should be off. But we'll be having a plenary session where we'll be able to interact, so look out for that. As we are represented from different parts of the country and regionally and globally, I invite us to introduce ourselves using the chat function. We can also use the chat function to post our comments, questions, and interact with fellow colleagues. I think that would be a most useful time of during this webinar. So welcome to each and every one of us. Again, from the Africa Research and Impact Network, we are happy to be co-hosting this webinar alongside esteemed colleagues. So I'd like to quickly jump into our program overview and sort of just take us through what to expect in this session. And of course, as I've mentioned, I'm Leah Aoko. I'll be the lead moderator, but I'm joined by esteemed colleagues. We'll be having an opening session by Dr. Anthony Wanaina, who is from the Ministry of Health. Dr. Anthony Wanaina will be leading us through the welcoming remarks, which we will have from Dr. Mamo from NEMA, Director General NEMA. We'll also have additional opening remarks from Dr. Patrick Amoth, that is from the Ministry of Health. We'll then cede floor to Dr. John Musau, who will be the moderator, taking us through some of the high-level panel discussion that we'll have and some of the key insights that we want to discuss during this webinar. And during this session, we will have our executive director from the Africa Research and Impact Network, Dr. Johannes Atela, who will be tackling some of the primary objectives and what we expect from the Pan-African Conference that we are gearing towards. We'll also have as a panelist, Dr. Elijah Songok, that is Director General from KEMRI, joining us to explore some of the critical and most recent scientific findings that will be relevant to the nexus of environment, climate change, and health. So he'll be able to highlight and discuss this. We'll also have, as a panelist, Dr. Gloria Maimela. Dr. Gloria Maimela is joining us from Chance Network, who have also co-organized this webinar, and she'll be looking at the specific opportunities that we have provided for in developing new collaborative projects, so that as scientists, as researchers, we stop working in silos and explore more collaborative partnerships. We'll also have as an esteemed panelist, Dr. Martin Mushangi. Dr. Martin Mushangi is joining us from AMREF Kenya, and he'll be exploring mechanisms that have been put in place to ensure that discussions and recommendations from this conference and even from this webinar translate into tangible actions and policy dialogues post the conference. We'll also have Dr. Lucy Mazianga joining us from Africa CDC, and she'll be exploring how the conference will address the critical issue of financing and financing for climate and health initiatives, especially within the African context. And then finally, as a panelist, we'll have Dr. Charles Lange, and Dr. Charles Lange will be joining us from NEMA. He will be exploring how this conference is going to showcase the role of technological innovations and regulatory policies for pollution control, ecosystem restoration, climate mitigation, adaptation towards healthy societies. So we do have a packed high-level panel discussion coming ahead of us. After this session, we'll have announcement of conference details, and I'll be calling up our colleague Anne Irungu, who has been useful and instrumental in organizing this webinar, and she'll be giving us more details on abstract submissions. I'm aware that some of us have already sent in their submissions, but for those who haven't, we'll be receiving a way forward on how that can be done. She'll also be detailing the registration details for all the delegates joining us within Kenya, within Africa, and globally. We'll also have sponsorship packages, which will be, again, extremely useful for organizations that want to join in sponsoring this esteemed conference that's coming up, and other details on the conference website, where you can get more information on how to join us. Again, it would not be a useful session if you do not have a Q&A and plenary, and that we will have. Set aside a session for the same, but again, feel free to use the chat function to introduce yourself, pose some questions. Our team is at hand to interact with the audience, to network with your colleagues as we get along the webinar, but we'll have a dedicated session for the question and answer. And then, of course, we will be closing this webinar by remarks that will be offered by Mr. Lolem Lokolile from the Ministry of Health, Kenya. A packed program. Welcome to each and every one of us, esteemed colleagues. I'll now be happy to cede the floor to Dr. Anthony Wainaina, joining us from the Ministry of Health to take over the welcoming remarks session. Dr. Anthony Wainaina, please confirm that you can hear me. Dr. Anthony Wainaina. All right. Seems like he's having a bit of a challenge to join us, but I'm very happy to invite Dr. Mamo from NEMA, Director General NEMA, to give us some welcoming remarks. Dr. Mamo, over to you. Kindly confirm that you can hear us.
Hello, Leah, can you hear me?
Yes, I can hear you loud and clear. Please go ahead.
And you can see me?
I can see you. Go ahead, sir.
Thank you. Distinguished participants, let me first take this opportunity to first acknowledge and recognize our distinguished colleagues, starting with Dr. Patrick Amoth, the Director General, Minister of Health, Professor Elijah Songok, Director General, Kenya Medical Research Institute, Dr. Mazianga, Regional Director, Africa CDC, Dr. Gloria Maimela, the Deputy Chief Executive, Foundation for Professional Development and Chair of the Change Network, Dr. Johannes Atela, Executive Director, Africa Research and Impact Network, Dr. Martin Mushangi, Director for Population Health and Environment of AMREF Kenya, colleague CEOs of agencies present in this webinar, both from state and non-state actors, the moderator, Leah, and session chair, Dr. Anthony Wainaina, distinguished participants, good afternoon. I am indeed pleased to join you for this important webinar aimed at sensitizing stakeholders on our upcoming Pan-Africa Environment, Climate Change, and Health Conference scheduled to take place from 21st to 24th October 2025. I am delighted indeed that this conference brings together the environment and health stakeholders on a common platform. This dialogue is essential for exploring how these two critical sectors can collaborate more effectively in addressing the pressing challenges that impact our societies. As science has shown, there are strong nexus between the environment, climate change, and human health. To respond effectively and efficiently to these interconnected issues, it is imperative that we adopt a coordinated and a multi-sectoral approach. The National Environment Management Authority, NEMA, established by the Environmental Management and Coordination Act of 1999, has been releasing the state of the environment for our country from 2003. And you'll notice that over the years, we have observed that significant shift in the country's environmental outlook. Many of these, or many of which, have direct implications for human health. For example, we are witnessing changes in water and ambient air quality, which may signal potential health consequences. Additionally, increasing patterns of population, biodiversity loss, and the impact of climate change continue to be registered with growing concerns. Distinguished participants, the challenges related to the environment, climate change, and health can only be tackled effectively through access to quality, up-to-date scientific data. As we all know, data is often scarce or at times outdated and may not be readily accessible to support evidence-based policy interventions. However, conferences and symposia have, over the years, become critical vehicles for disseminating essential scientific knowledge and data that can guide policy and decision-making. Therefore, this upcoming Pan-Africa Conference on Environment, Climate Change, and Health represents a valuable opportunity for stakeholders in both sectors to access innovative, data-driven insights. It is indeed a worthwhile investment, and I therefore urge all our partners, development partners, stakeholders, to support this vital initiative. Ladies and gentlemen, I am aware that the conference will cover 9 well-curated, innovative scientific tracks that address key issues across the 3 domains. The quality of abstracts received so far suggests that cutting-edge science and the most current data will be presented, data that will be invaluable for policy development and implementation. This is indeed a significant opportunity for knowledge exchange, and I therefore encourage all of you attending this webinar to submit your presentations before the deadline and to register for participation in the upcoming conference. It promises to be a rich platform of knowledge and experiences drawn from across Africa and beyond. I have also been closely monitoring the progress of the conference preparations with great interest. I look forward to its successful delivery and to reviewing the outcome report, which will provide critical recommendations for implementation under the environment portfolio. I have noted with appreciation that the conference brings together several previously planned engagements into a single comprehensive platform. I commend the organizing teams for setting aside their original plans and embracing this integrated approach. This harmonized approach aligns very well with the Government of Kenya vision of one government, one society, which seeks to minimize duplication while maximizing effectiveness and efficiency. As I conclude, distinguished participants, I wish to sincerely applaud the organizing committee for their dedication, hard work, and commitment in steering the planning of this conference towards success. NEMA, together with our parent Ministry of Environment, Climate Change and Forestry, remains fully committed to supporting the organizations and execution of this important event. I wish you all a very fruitful deliberations, and I thank you.
All right. Thank you so much for the useful welcoming remarks with emphasis on, again, collaboration and partnerships, acknowledging the challenges in accessing data and evidence for policy implementation. And this and much more are aspects that we are going to be delving into in this webinar. So I'd now like to have the pleasure of ceding the floor to Dr. John Musau from KEMRI. Dr. John Musau is joining us from KEMRI to moderate our high-level panel discussion. Karibu sana Daktari, over to you.
Thank you very much. The name is Musau Chanesa, not Dr. Musau, but I'll proceed, Leah. Thank you very much. Let me start by the salutations. I want to start by our senior officials in our Kenya Ministry of Health, led by Dr. Amoth, the Director General for Health. I also want to take this opportunity to recognize some of the 6 panelists that we'll be having a discussion with today. I want to start with recognizing or acknowledging Dr. Johannes Atela, Executive Director for ARIN. I'll use the acronyms. Immediately after that, I'll take this time to also acknowledge the presence of my boss, our CEO, the Director General KEMRI, Professor Elijah Songok. I also take this opportunity to also take cognizance of Dr. Gloria Maimela, Chair, Chance Network, Dr. Martin Mushangi, Director for Population Health and Environment, and that is AMREF Kenya. Dr. Lucy Mazianga, I hope I'm pronouncing it correctly, Regional Director, Africa CDC, Eastern Region. Dr. Charles Lange, Director, Environmental Services in NEMA. Our immediate previous speaker, Dr. Mamo. Our more than 190, as we count participants, distinguished scientists, stakeholders, ladies and gentlemen, all protocols observed. Good afternoon. I quickly want to get through to this. And this session is a high-level panel discussion. I think this forms the crux of the matter of our discussion today. And we will be hearing from 6 of our panelists. These are distinguished panelists, professionals, heading various institutions that are involved in the environment, climate change and health. And as I look at what we have today, we are trying to really harness this ability that we have in science that is so much well endowed in all of us, for us to be able to translate this into policy. I think this is not, I look at this more of a challenge than an impediment or a problem. And I wish to welcome the panelists this afternoon so that we can quickly go through this. A few ground rules, and please bear with me even as I put the ground rules. You realize this session has been allocated 1 hour. So I would request each of the panelists to confine to 10 minutes or thereabouts. I know we have, and if we must move ahead probably by 1 minute, because I know we are slightly ahead of time by 10 minutes, which you can redeem, but let it not have you go out there. So without much ado, let me quickly get to it and allow the first panelist. This is Dr. Johannes Atela, the Executive Director for ARIN. I wish to welcome Dr. Atela from Africa Research and Impact Network. I'm seeing Dr. Atela is ready to immediately just share with us what we want to look at. Remember, this is part of the launch, and it basically gives us the base or the foundation for what we were about to walk into. as a precursor for the conference in October 2025. Dr. Teller, what are the primary objectives, priorities, and desired outcomes of this conference, even as we look forward to coming to the conference and having heard what Dr. Mamwa said in his welcoming remarks? Dr. Teller, please.
Yeah, thank you so much, John, for your great remarks into the panel. As you've said, I'm Johannes Atela. I'm the director of the ARIN Network. The ARIN Network is based in Nairobi, and we bring together a network of over 200 researchers and policymakers from across 36 African countries. Our main mandate is to consolidate and support peer learning and exchange on evidence that can support actionable policies in Africa and beyond. And therefore, this conference is very central to our mandate as ARIN, and of course, our partners whom we work with. I just want to highlight that this conference is not just like any other conference that have happened, but we are looking at a solution-oriented conversation, which is aimed at providing collaborative solutions to the challenge that climate change poses to our environment, but also to health. From one of the resounding, or one of the most referred to studies we did recently, supported by Wellcome, where we were looking at the opportunities really for building collaborations to tackle the challenge of climate change, environment, and health. There are three interconnected challenges that we identified as critical or as really very significant with regards to Africa's pursuit to develop solutions that could address the climate and health and environment challenge. Number one is the issue of relevant and adequate evidence. And in this case, we talk about transdisciplinary evidence. Since climate change, environment and health comes from a diversity of disciplines and a diversity of sectors. So transdisciplinary evidence that brings together these sectors, that brings together innovations, technologies, and data that connects and links this sector, remains a big gap in the pursuit for solutions in this space. Number two is the issue of capacity. There is a lack of adequate skills really to be able to develop ideas and innovations that could tackle the challenge that we are talking about. And even some of the capacity building opportunities that exist in the universities or in our different think tanks basically is not yet integrated enough to bring together the various disciplines that really are involved in this space. And thirdly, and most importantly, the challenge of collaboration, health, climate change, environment, and many other sectors is not just a single sector issue. It's a multi-sectoral issue. So it draws issues from a range of sectors, energy, of course, environment, of course, agriculture, issues of nutrition. So it is a time that it's not possible to look at health issues or environment issues or climate change issues in isolation. But where we are today is that the governance systems of these particular disciplines and sectors are isolated. And in that case, collaboration remains a major challenge in the sense that we have a more sectorally based governance and policy systems. So this is a challenge that needs to be tackled. Now, drawing from those three challenges, this conference will seek to address three main objectives, and of course, with associated outcomes. The first objective is that we hope that this conference will provide a platform where we can have adequate knowledge exchange in terms of evidence, what is existing, what are some of the innovative data available, innovative information available on not just the impacts of climate change on environment or on health, but also the solutions that could help to tackle this particular challenge. Of course, there's a lot going on in Africa in different contexts, but these are not very visible. So through this particular conference, we hope that we are able to share, we are able to create awareness about the availability and usefulness of this evidence, not only for policy making, but also for action and for investments. So that is number one. And of course, this evidence will need to be, transdisciplinary. As I've said, this is the era where we are not looking at working in isolation. We will have to work together. We will have to build multi-sectoral and multi-stakeholder solutions. Number two objective that we hope to achieve with this particular conference is basically to support opportunities and make visible actions that are already being rolled out in different contexts. The innovations that are already addressing the challenge of climate change, health, and environment. In most cases, these innovations are not known or are not well visible so that they can be scaled up or they can be invested in. So we hope that this conference, which we target to bring over 600 participants from across Africa and beyond, with high-level policymakers, ministers, researchers, NGOs, the civil society, donors. We hope it provides an opportunity where we can showcase some of these emerging innovations, make them visible, and make them available for investments and scaling up. And finally, we hope that in this conference, and this is the most important part, is that we will create an enabling opportunity for collaboration. The director, Dr. Professor Mamo, has identified the issue around one government, a multi-sectoral framework for addressing the challenge of climate change, health, and environment. This is not an easy thing because you can, the path dependencies, the systems within which the governance of these sectors are anchored have been traditionally operating in isolation. So with this approach and trying to confront this challenge is not an easy thing, but we hope that we can create a conversation space that different actors, different sectors, different stakeholders undertaking different responsibilities are able to speak to each other, and from there coordinate, come up with a much more strategic, integrated, and sort of multi-sectoral, multi-stakeholder frameworks that really can confront the complex challenge of climate change, environment, and health. And this is not just a one-off event. We hope that we continue, even from the conference, to ensure that these outcomes in terms of collaborations are nurtured and matured into action. So, Leah, I want to stop there. And once again, I want to thank everyone on behalf of ARIN and partners, the government of Kenya, and all the partners who are part of this, and just wish us a good conversation as we move forward. Thank you. Oh, I give it back to you, John. Sorry, I mentioned Leah. So it's back to you, John, if you can hear. You're muted, John.
Sorry. I was just saying thank you so much, Dr. Teller, for that. And I was just saying for those of us who have any questions or any comments on this matter, kindly put them either in our chat box or go ahead and list them down, because we'd wish to go through these and then come back to this. Having said that, it is my humble pleasure to introduce the next panelist, the next speaker, who happens to be my CEO, my immediate boss. And this is Professor Elijah Songok, Director General and Chief Executive Officer, Kenya Medical Research Institute. Good afternoon, sir. I just wanted to introduce you to the team and just share out and request for you to be able to pick up the second part of the activity, and would be approaching these based on what has been said by the two earlier speakers. We know we have 4 thematic areas, we have 4 objectives, and with 9 tracks. And I know Kenya Medical Research Institute has been instrumental in participating in all this. I know in part of the conference, they also cover the fourth Health and Climate Change Scientific Conference by Ministry of Health and KEMRI. But let me take this time just to welcome you, sir. The second question is, what are some of the most critical and recent scientific findings in the nexus of environment, climate change, and health that will be highlighted? I don't know that you can hear me, sir, Professor.
I can hear you very well, John.
Yes,
thank
sir.
you
Go
very
ahead.
much. I think I'm trying to get my camera on. I think that's the one which is
Please.
not coming up, but at least you can hear me.
Yes, we can hear you, sir. Please go ahead. The camera will come on.
Okay, thank you. Yeah, thank you very much, John. And I'm really excited to be part of this particular panel. Yes, my name is Elijah Songok. I am an Acting Director General of KEMRI. And as you know, most of you, is that we are a leading key biomedical research institution in East and Central Africa. I want first to thank you, the moderator, Ms. John, and then to greet all our distinguished colleagues, our fellow panelists, the researchers, policymakers, and attendees from across the continent and beyond. Gentlemen and ladies, in recent years, the scientific community has increasingly recognized that the environment, climate, and health are not separate domains. They are deeply interconnected, especially in the African context. We are now seeing growing empirical evidence that climate change is amplifying health risks. Rising temperatures are altering disease vectors, increasing heat stress, undermining food security. Environmental degradation, such as poor air quality and loss of ecosystems, is directly impacting respiratory and mental health. Extreme weather events are disturbing health service delivery and damaging infrastructure. From a scientific standpoint, the nexus is not theoretical. It is real, measurable, and escalating. What are the critical and recent scientific findings? Let me highlight a few key findings that shape our understanding of this nexus. Number 1, climate change is linked to resurgence of infectious diseases. Studies in East and Central and Southern Africa show that malaria is emerging in highland areas, previously considered low risk due to warming temperatures. Research from coastal regions is linking rising sea surface, temperatures, and flooding with outbreaks of cholera and leptospirosis. Air pollution and respiratory diseases. Urban and peri-urban research has confirmed that high PM2.5 levels in low-income neighborhoods, often exceeding WHO guidelines. These exposures are now being linked to elevated asthma, COPD, and even poor health birth outcomes. The other one is heat stress and occupational health. Studies on agricultural workers and outdoor laborers show a decline in productivity and increased heat-related illnesses, including heat stroke and chronic kidney disease. The other impact is on nutrition and food security. Climate variability, including erratic rainfall and droughts, is driving malnutrition in children under 5, especially through impacts on maize and millet production. These changes in land use are also reducing dietary diversity in some rural communities. These are not isolated studies, ladies and gentlemen. They form the evidence base that this upcoming conference will build upon, while also encouraging new contributions across Africa. The thematic tracks of the conference. To respond to the multifaceted nature of the nexus, the conference has identified 9 key thematic tracks, each aligned with recent research priorities. Number 1, as I discussed, is infectious diseases and climate, predictive modeling, early warning systems, and One Health approaches. Track 2 is extreme heat risk and management. These are on heat wave adaptation strategies, housing solutions, and emergency preparedness. Track 3 is climate resilient environmental and health systems, which will focus on resilient infrastructure, supply chains, and workforce planning. Track 4 will be nature ecosystems and sustainable economics, which will focus on research on ecosystem services and nature-based solutions with health co-benefits. Track 5 will be on equity, ethics, and inclusive adaptation. This will address the disproportionate climate health burdens on marginalized populations. Track 6 is on governance and cross-sector policy. This will address studies on integrated planning, coordination, and institutional interventions. Track 7 will be on climate and health financing. This will address issues on economic modeling and cost-effectiveness of interventions. Track 8 is urbanization and built environments. This addresses healthy city design with the green spaces and adaptation in formal settlements. And then track 9 will be technology and digital interventions, will be the use of AI, geospatial tools, and mHealth for climate health surveillance and response. Each of these tracks, ladies and gentlemen, will provide a platform for transdisciplinary research and grounded in African realities and designed to shape real-world policy and practice. What is the call to action for researchers then? As the Director General of KEMRI, I want to particularly emphasize the need for, number one, robust data-driven submissions, not just diagnostics, but actionable solutions. Number two is case studies, impact evaluations, and implementation science that show what works, for whom, and under what conditions. Number three is contributions that bridge research with decision-making because of the urgency it is required now. What is KEMRI's role and commitment? As Kenya's National Public Health Research Institution, KEMRI has played a very foundational role in advancing climate health research, convening, and policy engagement. Over the past 5 years, KEMRI, together with the Minister of Health and key partners, have successfully convened 3 national health and climate change conferences, each in a different region of the country. In 2019, we did the first Nairobi First Conference, which marked the first formal engagement in Kenya, aligning public health research with climate change adaptation. We focused on that conference on building national awareness and setting the agenda for health system resilience. In 2023, we did a second conference in Kwale County, which we brought to focus coastal vulnerability, examining the impacts of sea level rise, waterborne diseases, and community health responses. Actively engage also with the county health departments and coastal researchers in framing decentralized climate health solutions. Last year, ladies and gentlemen, we did a 3rd conference in Machakos County, which took place during a period of heat waves and water scarcity, and research presentations focusing on heat stress, NCDs, and drought impacts. This resulted in practical recommendations for county climate health action plans and integration into Kenya's health sector climate adaptation framework. These conferences have helped to foster a growing climate health research community in Kenya, influence the development of the National Climate and Health Strategy 2024-2029, demonstrate KEMRI's commitment to regional equity by rotating the conference location to ensure inclusivity of diverse climate health facilities. This upcoming event, therefore, marks the 4th National Conference on Health and Climate Change, but with Pan-African scope, elevating Kenya's model, the continental stage. As my closing remarks, ladies and gentlemen, I wish to conclude that the upcoming conference is not just about sharing knowledge. It is about catalyzing transformation. We invite scientists, seasoned and early career researchers to bring forward their innovations, their experiences, and their findings, and let be a space where evidence shapes policy and science drives solutions. Thank you very much.
Thank you very much, Professor Elijah Sonko. Quite an elaborate bit of it. And I know, since I'm from KEMRI, I take this advantage of saying that it is exactly what my Director General has said, knowing that even KEMRI has dedicated a whole directorate to be able to handle, and department to be able to handle matters climate. I'm sure that will be shared even when you have a chance to tour and visit KEMRI. Now, having heard about the objectives of the conference and also listened to the scientific findings and the nexus by which research is going to meet policy. We want to just basically have the next session of the next presenter, who is Dr. Gloria Maimela from the from Chance Network, which is clearly, it's a long one, Climate and Health Africa Network for Collaboration and Engagement. And I want to, as we talk to her, we want to find out, because you already know the objectives, you already know the science behind it, but how do we harness the various networkings that we have? You realize the world has become a village, or the global village. And there's nothing that signifies the global village more than climate. The climate change is affecting us all over the globe, and it's something we need to share. So, Dr. Gloria, what specific opportunities are provided for attendees to network, form partnerships, and develop new collaborative projects that would be able to allow us to provide the necessary intervention or the necessary direction in terms of climate change, health, and environment? You're welcome, Dr. Gloria.
Thank you very much, John, and thank you for this opportunity to come and speak at in this webinar. You know, you're correct. You know, climate brings us together because it affects us all, especially in the African region. And before I respond to your question, allow me to give you a bit of a background about who the Chance Network is. Indeed, it's we are the Climate and Health Africa Network for Collaboration and Engagement, and the Chance Network was established in 2021 to bring essentially advanced policy, African policy on climate change and health. So we do this by bringing together researchers, policymakers, other stakeholders together under the same roof to deliberate on climate change, the impact of climate change on health, and we share learnings around some of the solutions that are there, pertaining, some of the, case studies that are out there, what other members are doing in various countries with respect to climate change and health. We also use the opportunity to bring the researchers together with the policymakers to support that translation of the evidence that has been generated, particularly in the African region and globally, to translate that into policy and then into action. So our specific objectives are to enhance network and synergies for climate change and health in the African region, to facilitate knowledge exchange, learning and cooperation, to support and inform evidence-based policy development, to also support, to facilitate technical support for access to climate financing and climate and health research and related, activities. We do that mainly through webinars, and I'm glad to announce that we have members, over 400 members across various countries in the African region, and we hold regular webinars with our members, and we also hold regular conferencing to bring them together for this knowledge exchange, and most importantly for networking. This is our fourth conference as well. We started in South Africa in 2022, where we hosted for our conference for the first time. Again, it was a kind of like the theme around bringing people together and sharing knowledge around the topic. And then in 2023, we moved to Botswana. And then in 2024, we were in, I don't know if, I'm sure some of you attended the CHAC conference in Zimbabwe, and we are extremely thrilled to this year be in Kenya, in Nairobi, with our co-conveners, most importantly, the Ministry of Health and the Ministry of Environment and our other partners as well. I also want to take this opportunity to thank our funders, particularly the Wellcome Trust, who have made this possible by believing in our vision and in our mission, and opening their pockets to make this conference possible. But also, again, all our other sponsors as well, and we've been meeting with a whole lot of sponsors who are also very interested, and they're keen to participate to advance this policy in the African region. Your question around networking, and that is in our name, and that's what we do well, because we believe that through networking, we are able to exchange ideas, we are able to grow. So as much as the conference provides information that is needed to advance climate change and health in the African region, we also understand the need for people to get to know one another, for people to exchange ideas. And as the Chance Network, we're very intentional about that, in a sense that as we work on our programs, we make sure that we leave space for people to do exactly that, to set a network. And, in the previous conference in Zimbabwe, we had, various countries sitting together and saying, this is what I'm doing in my country, this is the evidence that we are generating, and therefore we use that opportunity to learn from one another. So in the same spirit, in this conference, we are working very closely. We've got the scientific committee that's led by Professor Shari Kofferts from LSHTM, and also other partners as well. And we're developing a program with that intent to share knowledge, at the same time to allow for networking. And so we have, we're obviously finalizing the program, but we have within that program a specific event that we will be hosting to promote that engagement, whether it be side events, breakfast sessions, evening sessions, and so forth. As I said, we are very intentional to make sure that happens. So we are very excited, as I said, about this conference. It's getting bigger and bigger. And what we are loving about this conference, most importantly, is that for the first time, and we should be very proud, is that we're bringing, with climate change, we've always had the health side, the environmental health side, but now we are bringing everybody together under the same roof. And that for us is a great milestone, and well done to all the conference committees and the organizers of the conference in achieving this milestone already. So we're looking forward to an excellent conference, and I really invite all everyone here to tell other people about this conference, invite other delegates, and because we are very hopeful that this is going to be a very successful conference. So with that, I thank you. Over.
Thank you very much, Gloria, for that elaborate presentation. And I just, in Africa, in the African setting, we say, even as those who are lovers of engaging in meat eating. And I know in the southern part of Africa, especially Botswana, that area, you have a lot of beef to be taken there. Once you do the cooking, you'll see we have a culture of putting some salt on the side so that we make it better. So I just wanted to salt your talk and probably say it is true. And I'm looking at an area where we'll introduce partnerships that include industry players, because of course they're involved in the environment, and most probably even the people in agriculture. I don't know whether we have any in this, but just a thought as we go on and prepare for the conference. And we'll also look at, other than Wellcome Trust, what range of partners can we get? Could we even get joint products and all that? I don't want you to answer that now. Probably you'll do it when you're going to the Q&A session. And thank you very much, Gloria. I quickly want us to move to the next session. This is by Dr. Martin Mushangi. Dr. Martin Mushangi is the Director for Population, Health and Environment, AMREF Kenya. I think he puts together everything that has to do with climate, health, and the people. I think these are the people who really work out there. So Dr. Mushangi, as we welcome you through AMREF, and I know there are quite a number of AMREF programs, both projects and some interventions that are carried out in various places in the region. You may be able to share with us that, but as we go ahead during this conference, what mechanisms are in place to ensure that the discussions and recommendations from the conference translate into tangible actions or policy change post-conference? Because many a times you hear some of the main critics about some of the work we do in this area is that we sit in a lot of boardrooms, we go to so many conferences, we consume a lot of funds there, yet the real work is out there. So Dr. Mushangi, I don't know that I've prodded too much into you, but I know you're up to the task. Dr. Mushangi, please.
Thank you, John, for having me, and it's a pleasure joining this distinguished panel. Yeah, once again, colleagues, my name is Dr. Martin Mushangi, and I work for Amref Health Africa. For those who don't know Amref is a health NGO established here in Kenya. Our vision is creating lasting health change in Africa. And so we work with communities. We ensure that our work touches those communities, and especially the ones who are most disadvantaged. Now, that said, I think I would want to start by saying a big thank you, because it takes a lot of sacrifice, it takes a lot of wisdom, it takes serious leadership for collaborators to come together and say, that small thing which I was doing the other day alone, I want to bring it at the center and join hands with somebody, and so that it becomes something which is bigger and which is amplified. And that is what this conference is doing. I want to, first of all, say that these kind of initiatives have been there before, trying to bring together the ministries of health and environment to work together, beginning with the Libreville Declaration and many other declarations that have happened. But then there's a place somewhere where that is normally lost. This conference, I believe, is setting the pace in a different format, in a way that we can say the discourse that happens here will not just be lost to the voices of the people. It will be consolidated in a way that it can influence both the policy, the research agenda, and more importantly, the actions that happen in communities. And so at Amref, I would want to say that we have been building this momentum around bringing climate change actions together with health actions, appreciating the role of the environment, healthy environment, as part of social determinants of health. And we have been convening through a platform called AHIKE. Most of you have been partners in this initiative. And, you know, we've built momentums all the way talking about the Pan-African Common Position, which in a big way influenced the COP28 declaration on climate change and health. And moving forward, our thinking through how we can bring money to the table for the purpose of facilitating actions on the ground. So all these things are happening. But then, John, you asked the question, what is it that we are going to do uniquely within this conference? And I would want to say that the organizers ourselves, all of us, have thought through the processes, and we are very keen to say that, first of all, we are going to do the basics. We are going to have a very nice report with very clear recommendations that are going to shape the actions forward. Besides, we are going to produce very cogent and tangible policy briefs that we do believe that are going to influence certainly different touch points of the policy mix. And more importantly, when we were reflecting as a team, we said that it is important to ensure that now we have this as a momentum. We have this as a continuous kind of a forum, a conference which can occur Pan-African in a Pan-African way continuously. And so for that to happen, then we said, let's have a working group. So the other thing which we should look out is to appreciate the working group which is being formed. Number one, to ensure that we are monitoring all the commitments that are going to be made, and we hold ourselves accountable towards the journey that is going to be declared. Now, I want to say this as I end. If the conversations of this conference will not influence the way we innovate, and that is the science part, if it will not influence the research, and if it will not influence the actions, then we will not have done justice to the people who we serve. So we have so much focused to ensure that this conference is going to translate to that. And more importantly, by bringing together people, making sure that we have a system more than just having an event, then to make sure that whatever comes out of it will be sustained in the form of actions. So I want to end at that and invite each and every one of us who is in this room, first of all, to pass the message, and also to ensure if you have not registered, I know the registration is now open. Please make sure that you register yourself so that we be together. John, back to you.
Thank you very much, Martin, for that wonderful presentation. And just like you've said, we keep monitoring what has been said. And one of the things that we need to keep monitoring, some of the promises made. Once you face policymakers, and I don't want to go political on this, once you face policymakers in any entity, we hope that they'll not be speaking to us what we call politically correct, but they'll be preparing to be able to take some action and put some tangibles on the table. That is not for mitigation today, but I'll allow it to go ahead because the next presenter could be having something that will be able to explain to us how now we switch from getting the findings and the recommendations, which is translation and dissemination of the information drawn from the science that already Atala talks as the objectives about. Now we are now railing through, or you're walking through, and it's almost like a chain link of items that are being done. And we are getting to now the financing of how this would be done. And I think we have one gracious colleague, Dr. Lucy Mazianga or Mazianya. She'll collect that. She'll give us the idea on how will the conference address the critical issue of financing for climate and health initiatives, especially in Africa. And I know there's something that has been widely talked about at all levels, carbon credits and all that and the rest, but I don't want us to get into that. I want us to confine ourselves to matters the conference. But from time to time, I itch a bit. So Dr. Lucy, when I itch and I ask something, it's not in any bad faith, but it's in a way of trying to see whether we can trigger some things. I know we have quite a bit of time. This is just the launch. We'll be polishing ourselves as we walk. Dr. Lucy, you're welcome.
Good afternoon, colleagues, and thank you, John. Unfortunately, Dr. Lucy is caught up currently at the airport. He's coming back from another function in Uganda, and she just spoke to me. She's caught up at immigration. So I would give some highlights on her perspective. Dr. Lucy is the regional director for the Eastern Africa Regional Coordinating Center of Africa CDC. She is my boss. And I'll give some of her perspective as she shared it with me regarding the conference. Just to thank all speakers that have spoken before her and to also appreciate all colleagues that have joined the call this afternoon. I think this conference for her is one like no other, because many of the times we've talked a lot around science, research, generation of evidence, and all of those. But we're happy that this is a conference that is now tailored towards moving from science to policy, and we hope to move from policy to action. Just to suffice that Africa CDC, which I assume most of us are already aware of, but Africa CDC is a continental autonomous health agency of the African Union, established primarily to support public health initiatives of member states and to strengthen the capacities of their public health institutions to detect, prevent, control, and respond quickly and effectively to disease threats. And you agree with me that no other determinant currently contributes overall and overwhelmingly to disease threats and regional health security in Africa as does climate change. I think available evidence have shown that in the last 2 decades, these major determinants have been linked to over 56% of public health events in our region. So I think this is a critical and timely discussion. And Africa CDC also have understood and projected the need for us to look at alternative financing, innovative financing, and local financing to be able to drive our health securities, underpinning the fact that nobody will give you health security on a platter of gold. So I'm happy that this one of the tracks that this conference will be focusing on is looking at innovative financing to be able to support this transition from science to policy and policy to action. In Africa CDC, our Director General, His Excellency Dr. Jean Cassia, actually have highlighted the need for Africa to take ownership of its financing. And you will see one of our documents, Africa Health Financing in a New Era, having projected about 3 strategies. We are hoping that some of those things will be discussed at the conference. But beyond that, the conference has also identified and will be gathering a lot of donors and stakeholders in the room. And these are donors that finance different segments of climate change across the pillars that have been highlighted. And we're hoping that this discussion will foster innovative opportunities for financing all of the interventions around climate change and health in our continent. We also hope that we'll be able to discuss one of the critical funding opportunity that is available to both researchers and policymakers and implementers of climate change and health initiatives in the continent, and that is the Green Climate Fund. Recently, Africa CDC is supporting some 7 member states to see how we can access Green Climate Fund facilities. And I think that those are some of the key discussions that will be coming. I'm happy that John and our colleagues from Chance have actually sent our appreciation to Wellcome Trust, but Wellcome Trust is also another very major funder, especially when it comes to climate change and health research. And one thing that has also come very clear is the fact that they try to see researches that can be easily linked to policy and then policy to action. And so we're hoping to have all of them at the room sitting to discuss with not just scientists, but also to discuss with policymakers on how to be able to identify innovative approaches that can easily attract funds. We do also understand from the perspective of the conference conveners that there's also the gaps around the capacity to access even available funds. John had mentioned some of the funds that are related maybe to climate justice and other negotiations that are ongoing globally. There are global frameworks that have provided different opportunities for financing, but sometimes accessing those funds is like getting a camel through the eye of the needle. So I think that this conference will actually give us that opportunity to get the proponents of these funds and to be able to see how they themselves will be able to talk to our scientists and policymakers on how we can best access these funds. Another good thing that the conference is doing is bringing this coordination. And one of the things that Africa CDC is really promoting is the fact that we need to be more coordinated to be able to assess some of the funding mechanisms. And I'm happy that this conference is championing that. That coordinated effort will help us to see how researchers can group themselves to be able to access multi-sectorial fundings that operate under the One Health mechanisms. How can policymakers also group themselves using available platforms like the regional economic communities and different cross-border collaborative measures to see how they can collaboratively access funding. We cannot also undermine the impact of the pandemic fund that looks at regional entities, single country applicants, and how this can be best assessed using a One Health approach. So I think this is a conference that is a must attend for all of us. And I cannot say more, but join all my other colleagues to call you to join us in Nairobi as we discuss these thematic issues, but much more importantly, looking at what are the innovative mechanisms that we can be able to use to assess available fundings, both those that are globally, but much more importantly, looking critically at some of the other opportunities that lie locally. One of the things that have also come to fore is the fact that sometimes what you're looking for is in the house, but you keep looking outside. So let's also, we hope that we'll be able to discuss about how to better assess private sector financing, local financing, and also how health agencies and other sectors in this segment can better enhance their budgets or include climate change and programming into all of their interventions to facilitate budget for them. I'll leave it here. And this is just what I would say the juice. But let's come to the conference and have a broader discussion. Back to you, John.
Thank you very much from CDC Africa. And tell Dr. Lucy we wish her all the best. I hope she's not had any hold-ups at the customs section or at the immigration section. Now, quickly, because we wanted to redeem on time, and I'm sure we are doing very well on it, I just wanted to introduce the next presenter, who's from the National Environment Management Authority here in Kenya, Director Environment and Sciences. That's Dr. Charles Lange. And Dr. Charles, coming from the environment side, I'm sure you've had quite a bit from, it seems like the previous speakers were skewed heavily towards health. Now that we are coming to environment, which is also one of the main pillars in terms of climate change. How will the conference showcase the role of technology, innovation, regulatory tools, or policies for pollution control, ecosystem restoration, and climate change mitigation and adaptation towards healthy societies? I know as technical people, we really write a lot of technical stuff. And I know here we are speaking to ourselves among technical colleagues, but even as you go there, want to look at it in a simplified manner. Charles, please.
Thank you very much, John. I hope you can hear me, John.
We can hear you loud and clear. Go ahead.
Thank you very much. Yes, allow me also ride on the already established protocols and start by appreciating my boss, of course, who made the opening remarks, Dr. Mamo B. Mamo. Appreciate other DGs who could find the time today and CEOs of other organizations to come to this webinar. I want to indicate that indeed, as you said, has coming from the environment. I think my boss really gave a very inspiring opening remarks that he said that from us in the environment sector, the National Environment Management Authority, which is a supervisor and which supervises and coordinates matters environment in Kenya, has been undertaking the Kenya State of Environment Report over the last several years. And as the speech said, one of the key things that we have said, we have seen is that there is a lot of dynamics in the environment that has a lot of implication on health. And so let me allow me first start by saying that the coming together between environment and health is a great blessings, because some of these things that we have seen, we have been addressing them from a sectoral point of view, whereas they need a multidisciplinary approach in trying to address them. And so I write on what other colleagues have said and say that indeed this is a great initiative for us to begin working together so that we can address these things from a disciplinary approach. Now, coming to the question that you said, I want to indicate that this conference has been specially designed to address these issues that we have found from the Kenya State of Environment Report and other scientists have found from a technological perspectives. I want to indicate that indeed, many of the challenges that we face can no longer be addressed from a traditional perspectives. And so why this conference was specially designed, and one of the tracks that seeks to address, to cover technological innovation, digital solutions for climate, environment, and health. And so we expect, as we have seen from the flow of some of the abstracts, some of the best homegrown technological solutions that have been developed from various studies that are going to be showcased in this conference. We know that it is not only that the high-tech technologies that we can always depend on in addresses many of the challenges that affect environment and health. And so by bringing this conference, we are encouraging the homegrown solutions and technologies that are coming, and we are excited that we are going to see some of the many homegrown technological solutions coming in this. Coming from the digital space, we know that there are already ongoing technological developments that are happening that are many of us, those coming from policy or coming from the general public, are aware of. We know of geospatial technologies, we know satellite imagery approaches in dealing with issues. And so this conference is a unique one that, as colleagues have said, should no one be left behind to come and witness some of these solutions, because as I want to reiterate, we cannot address things from the traditional approaches. We need a blend system where we have technology starting to play front space in addressing many of the environmental and health issues that we face as a society. We know there is going, as we've seen in the flow of the abstracts, there are cutting-edge technologies that have been developed, and some of the flowing abstracts that are coming through, they are coming with to showcase as case studies of some of these technologies under this track that I've just mentioned on technological innovation, digital solutions for environment, climate change, and health. And so this is the opportunity for us, particularly those coming from the policy, to come and try and find out some of these solutions that are coming from technological and digital solutions that can be applied to address the issues that we face as a country from a policy perspective. And so, as colleagues have said, and the panelists have said, I want to say that this is the moment where everyone should not be left behind. Everyone should register on time. And those of us who have also taken these technologies, who have not been able to submit these case studies, to find time for the deadline, because being member of the National Steering Committee and Scientific Committee, we have even looked at the flow of the abstracts. And we think that the kind of abstracts that are coming from the cutting-edge research and technologies, that we probably are considering extending the deadline for the abstracts to for one more week, so that we can also open up the opportunity to see more of these technological solutions that we look forward to seeing and sharing with the Kenyans to be for the people to, or for those with the technology to be able to register and come to share with you. In the opening remarks, we were told that indeed, whereas there's a lot of research technologies that has been happening, the largest challenge is the access to these technologies and information to influence policy. And so having this conference that really blends all these sectors, the environment, climate change, and health, is the greatest opportunity that indeed we can have access to these technologies and information that are not easily accessible often. And so mine is to rally with the rest of the panelists and speakers and call upon all people from all walks of life within Kenya and Africa and beyond to come with Interact, and we share these technologies and many other information that is critical. My previous speakers have said we are piloting this. If this becomes the norm, then a very good idea. Then we're going to have this run throughout in the coming years as a joint venture. And so we look forward for a very successful conference. So lastly, once again, I call upon all of us who are in this call to spread this message of this conference, and also to look through the website and to see the important dates of this conference, so that you can be able to register for abstracts or register for participation on time. With this, I want to thank you, John, and back to you. Thank you.
Thank you very much, Charles, for that elaborate presentation on your section. I think this session, I want to bring this session to an end with 6 minutes to spare, because it started at 20 minutes past 2, and we are getting through it in 20 minutes past 3. The beauty about working with technical people is that they keep time. These are people who are very, very knowledgeable. Leah, I'm sure you agree with me that I think our ability to be able to stick within the schedule of time that is given has been very good. I want to take this opportunity just to thank all of you and pass this on to Leah. Leah, please.
Thank you, John, for that really insightful session that we've had. I see there are some questions and comments in the chat section, and just inviting more of us to send those through. We will be having a plenary session shortly afterwards. I'd like to just confirm if Dr. Patrick Amoth has joined us from the Ministry of Health. I don't know if he has joined us at this point. Dr. Patrick Amoth.
Yeah, Leah, I want to this is Lolem. I want to put it that Dr. Patrick Amoth just wrote me a text. He was to be represented by our Director of Public Health, Dr. Grace Ikau, that she is out of town. She tried to log in, but couldn't get in. So she's really, really apologizing on behalf of the DG. Yeah.
All right. All right. Well noted and well noted, sir. Thank you, and probably he'll be able to join in the conference that we are anticipating. At this juncture, it is my pleasure to invite Ms. Anne Irungu. Ms. Anne Irungu is going to be tackling some of the conference-related questions that I have seen in the chat and the Q&A function. She'll be looking at conference details, abstract submission, I think that has been touched on by Dr. Charles Lange. We'll also be elaborating on registration details. I've seen questions on whether there are scholarships, sponsorship opportunities for the youth. She'll be able to clarify on the same. Sponsorship packages, if there are organizations represented herein that can offer their assistance, financial assistance. There are sponsorship packages that will speak to the same. And finally, the conference websites, emails, contact details, so that each and every one of us is able to access this information easily. Ms. Anne Irungu, if you're able to hear me, I'd love to cede the floor to you.
Thank you, Leah. I'm very excited to let in everyone on the details of the conference. Allow me just to share my screen in a few. I hope everyone can see my screen. So as you're aware that this conference is the Pan-African Conference on Environment, Climate Change and Health, Science to Policy. And the main theme of this conference is harnessing science, policy and partnerships for environmental sustainability and climate health resilience. And the venue will be at Emara Ole Sereni Convention Center. And the dates are 21st to 24th October 2025. So this conference will serve as the fourth Climate and Health Science to Policy Conference by Chance Network, the second ARIN International Climate and Health Conference, the fourth Health and Climate Change Scientific Conference by Ministry of Health and KEMRI, and the inaugural National Environment Conference by Ministry of Environment, Climate Change and Forestry, as well as the National Environment Management Authority, that is NEMA. So these are the conveners. We are 8 conveners in total. That is the Ministry of Health, the Ministry of Environment, Climate Change and Forestry, the Chance Network, the Africa Research and Impact Network, the Kenya Medical Research Institute, NEMA, AMREF, the Aga Khan University Institute for Human Development, as well as the Africa CDC. So a lot has been spoken about how climate and health affects Africa, developing countries, especially in Africa. And therefore, this is an urgent call for the need to translate scientific evidence into policies and actions, and the need to have stronger multi-sectoral collaboration and knowledge exchange, which are critical for effective adaptation and mitigation. So this conference builds on prior Chance conferences, that is, one that was held in Pretoria in 2022, Gaborone in 2023, and Harare in 2024. It also builds on ARIN's 2024 Climate and Health Conference, which had a focus on transdisciplinary research. And then it leverages the Kenya's Ministry of Health and KEMRI experience in climate and health conferences in Nairobi 2019, Kwale 2023, and Machakos 2024. And it aims to bring together researchers, policymakers, private sectors, donors, and civil society society. The focus will be, but not limited to, science policy translation, innovation showcase, as well as capacity building, and it will help to promote best practices for climate action, health resilience, and economic growth. And one of the key best practices is that it will include community-led organization to uplift climate health literacy through the integration of indigenous knowledge with Western science. So why does this conference matter? So it will drive measurable impact that will move beyond dialogue to track commitments and real-world implementation. It will also launch research policy labs where policymakers and researchers will work together to co-develop solutions to climate and health challenges. It will help build long-term partnerships and foster a lasting ecosystem for science policy innovation collaborations. And then it will track policy progress and review outcomes from the past conferences that have been held by the Ministry of Health, ARIN, Chance, and Cambry, and it will enable to inform the 2025 State of Evidence report on environment, climate change, and health in Africa. It will establish a technical working group that will help drive integration of health into environment and climate change policies, the NDCs, as well as the Conference of Parties. It will help strengthen financing and civil society alliances by supporting joint advocacy and mobilization towards COP30, COP32, UNCBD, COP16, as well as UNCCD, COP17. It will also help shape future agendas, for example, the oncoming Climate and Health African Conference 2026 that was preceded by the CHAC 2024, the COP32 biannual National Environment Conference, and the post-COP implementation plans. And it also welcomed global partners through the engagement of actors such as the UNEP Africa Group of Negotiators and Innovators to build skills for integrating health into climate action. So this is just a pictorial of our registration system, our conference website, and our abstract registration, our abstract submission system. As you have been told that we have extended the abstract submission to 10th of August from the 3rd of August 2025. Once you go to our conference website, you'll see two tabs where it will lead you either to the conference registration portal or the abstract submission portal. The registration deadline is on 30th September 2025. So some of the tracks that we are looking into this conference is the evidence and intervention for infectious diseases. We have extreme heat risks and management. We have transdisciplinary approaches for climate resilient environmental and health systems. We have nature, ecosystems, and sustainable economies for health and well-being. We have equity, ethics, justice, and inclusive adaptation in the environment, climate, and health nexus. We have governance, leadership, cross-sector collaboration, and policy for integrated environment, climate change, and health action. We have climate finance for health and environmental adaptation and resilience. We have land use, urbanization, and built environments in a changing climate for healthy cities. And lastly, we have technological innovations and digital solutions for climate, environment, and health. So I'll let Dr. Marquette, who's my colleague, to join us and give more information on the sponsorship packages, as well as any other information that is coming up. We have had a lot of questions where whether we are giving funding. We have seen that AMREF and its partners in East Africa and South Africa Research Hub on Climate and Health, that is funded by IDRC, will be calling and funding a few PhDs and early career researchers. So you can be on the lookout for that call. I'd like to just give a brief overview again of the registration fees. For students, we are charging $80, which is a subsidized rate. For the African delegates, including Kenyans, we are charging $200. And for international delegates, you are charging $250. At this point, I'd like to welcome Dr. Marquette, who will give an overview of the sponsorship packages, as well as the rest of the partners who have joined us. Dr. Marquette.
Thank you so much, Anne. I believe you can hear me. Please confirm that you hear me.
Yes, we can.
Before I proceed. Thank you. Thank you. Thank you so much for the prior speakers for elaborating and setting the tone about this conference. So allow me just to speak to how you can be a part of this conference in terms of sponsoring something, and also in terms of, taking care of your needs as a participant. So we have first package covering the sponsorship packages divided in 3 tiers. We have platinum, gold, and silver. And all these 3 comes with a range of benefits. The first one is branding and visibility in terms of sharing your logo, link on the conference and organizations, institution websites. We also have speaking and engagement. This one, if you pick one of these packages, it gives you a range of opportunity to speak, either at opening or closing, or even plenary sessions, breakout sessions, as well as hosting an exclusive site event. So it also comes with complimentary registrations. For the platinum, it's 8, complimentary registration, gold 6, silver 4. It also gives you exhibition and promo exposure, whereby you're given a reserved sitting at plenary sessions, also given a branded booth in high traffic area. During the conference, we have the aspect of VIP packs and digital exposure, which ranges across with just minimal differentiation between these 3 sponsorship packages. And if you could move to the next slide. Yeah, we have also the additional sponsorship packages and conference experiences. For example, for the civil society, CBOs, startups, whether you're coming in as an exhibitor or international delegate sponsor, regional delegate sponsor, also comes with a range of benefits. Just to mention, we have branding feasibility, whereby the logo of your organization as well as the link can be embedded on our websites for recognition in the final report and during the program. And also that varies minimally across all those packages. Also the aspect of speaking and being recognized during the conference. So that applies for the civil society or the startup package, but this does not apply for the exhibitor. It also provides an acknowledgement in the opening remarks for the international delegate. We have the engagement and networking, whereby for the civil society, you can get to complimentary registration. You can co-host grassroots focus sessions. Yeah, so then we have for the international delegate, you also get to complimentary registration. Yeah, so then also exhibition and promo. Yeah, again, packs and exposure, which are differentiated across the choice of your package you can choose. Next. And if you could move, yeah. So still we have for the aspect of conference experience sponsorship packages, we have the lanyards and ID, which is with an investment description of $3,000, whereby the benefit that a sponsor gets is a logo co-branded on all delegate lanyards. You're also given high visibility. We have another one for the opening cocktail reception going for $4,500. And also this one, you get some benefits as described on the other end. You can also host a breakfast event at a cost of about $4,000. You can provide private breakfast session for up to 50 high-profile participants, featuring a panel or discussion hosted. We have also the networking lounge sponsorship going for about $5,000, whereby you're given the dedicated branded lounge space within the venue for delegates to connect and collaborate. We have additional benefits that you get as a sponsor regarding the choice you make here. And next. Yeah, so far, these are the sponsors or partners who have already, taken some of the sponsorship packages. They have also committed to host some breakfast, some exhibitions. So at this juncture, we call upon any CBO, CSO, international organization, if you could come, pick on one of the packages or also design how you can come to be a part of this conference in one way or many ways. So you could pick one or many packages and be a part of this. And we also provide the listed benefits accordingly, so that even the brand that you intend to showcase during this conference will be given the justice it deserves in terms of visibility and also networking. So that's it from me. Thank you so much. Back to you, Leah.
Thank you, Ms. Anne and Dr. Marquette, for that elaborate explanation on how each and every one of us can participate in the Pan-African Conference. And really the true essence of this webinar is engagement. So we'd like to hear from you at this juncture during the plenary. If you have a question or a comment, we'll be happy to look at the same and give you an opportunity to speak to the same. I'd like to encourage our panelists to please stay with us, to stay put. That is from Dr. Johannes Atela, Professor Songok, Dr. Maimela, Dr. Mushangi, and Dr. Charles Lange. Kindly just stay put with us as we go through this plenary session. And perhaps as I wait for any raised hands or comments in the chat section, I'd like to begin with an inquiry from Jeanette John, and this I'd like to direct to Gloria Maimela and Dr. Johannes. Kindly, if you could provide brief deliberation on this question. And he asks, are there any initiatives or opportunities to map and link outcomes and participants of different conferences such that these can be built onto and progress can be tracked to reduce duplication? I know this has been alluded to, but I'm happy to give the platform to our esteemed panelists, starting with Dr. Maimela, to just look at how is this conference and other conferences that are being held being tracked so that we reduce duplication and we ensure that there's efficiency and progress is tracked in the area of environment, climate change, and health. Over to you, Gloria.
Thank you very much, Leah, for this excellent question. And, you know, from the onset, when we were planning this conference, we meant to do exactly that, to see, you know, what's going on in the region, to involve as many stakeholders as possible who are, you know, part of this, what I call the African Climate and Health Move, so that we do not duplicate. So we scanned, you know, what, you know, the other conferences, other activities that are happening within the region, and even beyond that. And for example, you know, we were going towards COP30 in Brazil. And so we looked at that and we thought, okay, now that we have these activities, how are we going to be different? How are we going to make sure that we do not duplicate what's happening? So two ways is, again, you know, making sure that they too are aware, but also structuring our content in a way that it is progressive, and it doesn't duplicate. So what we've done, you know, we are also kind of hosting pre-conference webinars as well to already start engaging people on the topics and seeing who's who out there. And then we're going to have post-conference webinars to do exactly the same. But as I said, we are, you know, we're looking at the outcomes as well, and making sure that the outcomes feed into the narrative going forward in this space. And I'll give you an example. Like, for example, we had the Harare Declaration last year, and we will be talking to our counterparts from CHARC to discuss how can we then help to make sure that we move this forward responsibly, and so that it's an ongoing dialogue, and so forth. And I think this webinar serves as a platform for any other stakeholders who might feel that we have not yet included them. Please come on board, because these are some of the things that we want to make sure that, when we do host another, this conference going forward, that, the narrative is the same for the African region, because we want to advance African climate and health and environmental policy uniformly. So yes, this is an opportunity for you to join us, to share with us, so that as we refine, the content and we refine the agenda, to make sure that it moves us forward and it's not duplicative. Thank you.
Absolutely insightful and very important to ensure that efforts are being consolidated across the board. Dr. Johannes Atela, happy for you to chime in.
Yeah, thank you, Leah. I think Gloria has captured much of it, but just to add briefly that the previous conferences, from the conceptualization of this conference, is that previously we've had conversations that to an extent has driven the policy ambition at the global level in terms of climate change and health. For the first time in COP28, we had close to 60 ministers of health attending the climate change conference. That was not the issue, the practice before. So climate change COP conferences were often left for the climate change experts and environmental experts. So there is a policy ambition that the previous conferences have built. Now, this conference adds value in the sense that now it moves that policy ambition to try and match it with the need for, evidence, the need for collaboration to actualize those policy ambitions, because it's quite a complex challenge. So that to me is the track that all this is moving towards. Thank you.
All right, and thank you for that addition. Very useful. And I'd like to quickly move over to Mohammed Hassan. And this question I'd like to direct to Dr. Mushangi, who is still with us. Kindly indulge us to answer Mohammed Hassan's question. And he asks, in strengthening climate resilient health systems, how are governments and partners, now in your capacity as a partner, addressing the unique health needs and access barriers faced by persons with disabilities during climate-induced emergencies? So just give us a snippet on how government and partners are addressing the unique health needs and challenges, access barriers being faced by persons with disabilities during climate-induced emergencies. Dr. Mushangi, please go ahead.
Thanks, Rhea and Mohammed. I think this is a question around equity and inclusion. And that's a very nice question, because if we don't want to leave anyone behind, then we have to carry ourselves in a way that everyone is included within programming, within policies and investments. So now, in a very direct way, and in my understanding, most of the policies that are within the UNFCCC actually recognize gender. They recognize that indigenous communities exist, people with disabilities exist. Now, the gap is around investment, and not just necessarily financial, but also in actions. And this is where we need to have a touch point. Mohammed, I would want you to carry that question with you, so that when we convene in Nairobi, make sure that we are also asking that question, so that all of us remain proactive to ensure that we are not just talking about it, we are not just putting issues of equity and diversity and inclusivity in policies, but we are having healthy discourses, and we are moving forward to implement what we commit to. So Leah, it's a promise to Mohammed that proactively we need to move forward to question how well we are moving forward to implement the policies which are in place. Thank you.
Absolutely. And the question on leveraging some of the capacities that we have to address the access barriers for persons with disabilities and other social groups that need to be included in the conversation, I think remains a very key area of opportunity. for government and partners. I'd like to give an opportunity to Asmamaw Abera. Asmamaw Abera, I see you have your hand up. Are you able to unmute and address us? Please go ahead. Asmamaw Abera, are you able to address us? Kindly unmute. I also see Giram Hailu. Giram Hailu, if you're able to speak, we'd be happy to. Yes, go ahead, Asmamaw.
Hello. Thank you. It is clicked by mistakenly. I don't have any question. Okay, thank you so much.
All right, and thank you so much for joining us. Thank you for joining us, sir. So over to you, Giram Hailu.
Thank you so much, Leah. This is Giram Hailu from IGAD. I am the policy and partnership expert at the Health Emergency Program in IGAD. Thank you so much for the invitation, and this is a wonderful webinar, launching webinar for this important upcoming conference. So my question and my suggestion would be for the organizers, if they have considered the role of REX working on behalf of the community of nations in Africa, REX need to be engaged in this Pan-African conference and in a very active and in a very strong way. This is my belief. Some of the REX, including IGAD, have started implementation and also programs in One Health, Climate, and Health Nexus. So as we have also a good best practice in the region, together with other REX and supported by the African Union policy and also Africa CDC's support, we would like to make the member states, and we would like to complement what the actions are taken in the member states in the countries. So moving forward to translation of policies into action, I think we need to have a consensus and also at least a consultation, because this conference, I believe, is unique in nature, having environment and also the health people and also the climate people together. So this is a unique forum, a very important forum, and I think we need to see what will be the role of REX in making the country's effort coordinated. So if they thought about this, I would like to hear. And another one is for the development partners. This is a very resource intensive and also financial issues to be addressed. So in the conference, as an outcome, we expect a call for action so that the partners and donors and also financial institutions will take this as a guiding working document to support many of the initiatives. So I would like to see if there is a call for action expected from this conference. Thank you so much, Leah. Back to you.
All right, and thank you, Giram from IGAD, for your deliberations. And I'm curious to know if our representative from Africa CDC is still with us. I know that Dr. Lucy Mazianga had sent her apologies, but had a representative, Charles Akataobi, are you still with us to help us deliberate on the issue of REX? How are we engaging the regional economic blocks in this conversation? Charles, are you still with us? Okay, if he's unable to speak to the same, that is well noted, Sir Giram, and we'll be able to deliberate more on it during the conference. I'd also like to read some of the comments that you are sending through in the question and answer function. Pandi Stephen Shepherd says, I feel persons with disabilities are left behind. I think that we've already seen the issue of inclusivity. Being a Commonwealth Disabled People's Forum, I'm really touched when I don't see safeguarding policies and reasonable accommodation being implemented. And hence, he's calling upon the organizers who have taken note to safeguard and consider working with experts in the disability fields to ensure that these people with different impairments are considered. And in case support is needed, he's happy to engage in that conversation. Thank you, Mr. Mpandi, for that observation. I see, Charles, you're able to address us now, and I'd love to give you the opportunity to sort of speak to Giram's observation and questions. Over to you, Charles.
Hello, Leah.
Yes, I can hear you. Please go ahead.
Yeah, sorry, I had a little bit of internet breakage, but I don't know if you could recap what you just had. Yeah.
Yes. So I'm just requesting for a bit of slight deliberation from Giram's question. He was asking how partners, and in this context specifically, I'd like CDC to comment how it is engaging the regional economic blocs in this conversation on environment, climate change, and health to ensure a bit of coordination and collaboration on that front. So if you have any insights towards the same, we'll be happy to have you chime in.
Okay, thank you very much. And thank you, Dr. Giram, for those insightful thoughts. Yes, we've been working closely with IGAD and the rest of the RECs, of course, especially around climate change and health. And I think maybe when I was making my compliment, I did highlight a few things. The fact that we needed to bring all of the RECs together on this. I do know that we've also sent out the advert, but one of the things that we might need to do from the conference planning committee is to send specific communication to the RECs to also consider holding specific track-oriented side events that they might want to use to showcase what they're doing. But I think this is a critical area that the IGAD will really contribute to because this is science to policy, and IGAD has, as part of its overarching intercessions, one of the things they have a climate prediction center where they have to churn out information on meteorological information that can really help early warning action. So, and they also have quite a number of projects that are aligned to what we're discussing. So I think it's something we take off from here so that the planning committee, we can articulate how to have a specific segment for the RECs. And thank you, Dr. Giram, and thank you to all of us here.
All right. Thank you so much for that useful intervention. I'd now like to go to Linus Gerald, and Linus Gerald asks, how is climate change worsening health inequalities in Africa? Linus, I invite you to join us during the conference to sort of unpack this very loaded question and look at how the poorest and most vulnerable who are disproportionately affected are being included in some of the policy implementation mechanisms. I'm happy to also cede this question to our representatives from NEMA. I know Dr. Charles Lange. Dr. Charles Lange, if you're still with us, kindly address Linus's question on the role of environmental degradation in emergence of new diseases. How does deforestation, loss of biodiversity, and urban sprawl increase the risk of zoonotic diseases, Ebola, the Rift Valley fevers that we are seeing around? What is the role of environmental degradation on this front, and perhaps what are the steps, some of the steps briefly that the government is taking to address this? Dr. Charles Lange, if you're still with us, I'm happy to let you address this question from Linus. Please go ahead.
Thank you, Leah, and thank you for that question. I want to also, as you just answered to the other questions, invite the person or the participant who was that to this conference and encourage others who are interested in this kind of subject to come to this conference, because this will heavily be unpacked during this. But just briefly on this, there is a lot of scientific evidence that showing that the land degradation is one of the issues that is increasing risks for transmission of some of the diseases. There is what we call sometimes zoonotic diseases. So as more you destroy the environment, the more the risk that's coming up for transmission of some of the zoonotic diseases because of the increasing interaction between the reservoirs and the humans and so as others. And so there is a lot of evidence if you go into seeking in various publications, you can see a lot of evidence of information on this. But for more interactions, as I said, there is going to be also a lot of topics around this. And so I want to encourage those who are interested in this subject to also consider registering this conference to come and so interact. And those interested also in partnerships, networking with this, come to this conference and they'll put the right partnerships to understand more about this. Back to you, Leah. Thank you.
All right. Thank you for addressing us on the same. I'd like to invite Ms. Anne Irungu because some of the participants are asking, is there a virtual option? Is there a virtual option? I know it's a global village and someone might want to join us virtually. So are there opportunities for such participants to join in the Pan-African Conference? Ms. Anne, if you're with us, please go ahead.
Thank you, Leah, for that. Sorry, thank you, Leah, for that. We'll be communicating that once the deadline for the physical registrations closes. So we'll be communicating if there will be provision for virtual attendance and how they can access the virtual attendance for this conference. Yeah, thank you.
All right, thank you. And kindly look out for the registration links, website links in the chat box. I'm sure we have been sending those and sharing those with you. In case you have any further questions in terms of registration, applying for a side event or sponsorship details, scholarship details, even for financial assistance, kindly direct your questions to the information that has been posted in the link. We have also posted a survey that we are inviting each and every participant to take so that we can scope and see where you are representing, where you're joining us from, which organizations you're representing, or even if you're an individual interested in the thematic focus of environment, climate change, and health, you are welcome to join us and participate in the discussions that will be taking place in October. Having said that, I'd like to invite Mr. Lolem Lokolile, to give us closing remarks. It has been an insightful discussion, and I'm happy to bring us to a close by ceding floor to Mr. Lolem Lokolile for his closing remarks. Thank you.
Thank you very much, Lucy, and congratulations with your team of panelists, Dr. John Musau, Anne Irungu, and all the team. Really appreciate your great efforts in terms of ensuring that we keep time. And also on behalf of the co-chairs to this conference, being a conference that transcends one sector and many other entities, including non-state actors. Now that we are seeing it's the non-state actors that is leading this through ARIN. We are all in it and it is ours. Really wish to really thank everyone, acknowledge the efforts of everyone, right from all the co-chairs, from KEMRI, from ARIN, from CHANS, from NEMA, and all of you, distinguished guests, respected colleagues, and all participants. As we draw to the close of this important webinar, allow me to sincerely thank each of you for taking time out of your schedule to join us for this official launch of the Pan-African Conference on Environment, Climate and Health, Science to Policy, which will be held, and as we have been told, from 21st to 24th of October 2025 in Nairobi, Kenya, the Imara Ole Sereni Convention Center. Over the last 2 hours, we have had a rich exchange of ideas from the visionary objectives of the conference, to the most recent scientific findings in the climate, health, environment nexus, to the concrete opportunities for partnership and financing, and the mechanisms to ensure accountability and action post-conference. These discussions have captured the very essence of why this conference is urgently needed. This is not just another event on the calendar. This conference is critically, and we've been told, quite unique. It brings together 4 different conferences. The 4th National Health and Climate Change Conference that is led by the Kenya Ministry of Health and KEMRI, the 4th Science to Policy, Climate and Health Conference by Chance Network, the 2nd ARENE International Climate and Health Conference, and the inaugural National Environment Conference by NEMA and the Ministry of Environment, Climate Change and Forestry. This integrated Pan-African event reflects a convergence of sectors, disciplines, and regions coming together with one unified goal to translate science into policy and actions for a climate resilient and health secure and environmentally sustainable Africa. From the discussions today, we've been reminded of a few critical truths. Climate change is not a future threat, it's a present reality, shaping disease patterns, burdening our health system, impacting our food system, our environment, our water security. But science gives us not only a diagnosis, it gives us a direction, and we have the knowledge, the data, the tools, and the people to drive impactful solutions. What we need now is coordination, partnership, commitment, and courage. The upcoming conference will provide this platform to showcase cutting-edge research across 9 strategic tracks, launch policy labs and working groups to move beyond dialogue and into implementation, foster network across government, academia, civil society, and the private sector, and perhaps most importantly, elevate African-led innovations and evidence into national, regional, and global decision-making processes, including NDCs, updates, and COP negotiation. We are pleased to announce that abstract submissions are now open, and we are also pleased that this has been extended to 10th of August. And so we urge you to submit your abstracts, share with your colleagues, share with your other networks. And details of sponsorship, registration, and participations, have you been told, are all available on the websites of all these organization, convincing organizations, the conference webinar, the website, and all these convening organizations' websites. We will also host pre-conferences activities, including World Environmental Health Celebration Days together with Machakos County Government, and the Mazingira Day tree planting campaign on 10th of October. All these are physical events. There will also be many other pre-conference webinars and activities that are going to be announced in the conference website. And I want to profoundly thank our esteemed speakers, Dr. Johannes Atela, the Executive Director from ARENE, Professor Elijah Sonkok, the Acting Director General, Kenya Medical Research Institute, Dr. Gloria Maimela, the Chair of the Chance Network, Dr. Martin Ushanki, the Director, Population Health and Environment and Climate, AMREF Health Africa, Dr. Lucy Mazianga, and Charles Akatahobi, from the Africa CDC, and Dr. Charles Lange from the National Environment Management Authority. And finally, and not the least, is the National Environment Management Authority Director General, Dr. Mamo, who gave us the opening remarks for the thoughtful and thought-provoking contribution. I also acknowledge our moderators, excellent moderators. Thank you very much, Leah, and thank you very much, Anne. Thank you very much, Dr. John Musau, and thank you very much, ARENE, Chance, and all the convening organization, KEMRI, NEMA, Africa CDC, all of you, the ministries, we are all together in this. for all the coordination and the seamless approach that all this has taken. We really, really thank you. And to all institutions represented here, your presence today is the first step forward to collective action. We now invite you to stay engaged, submit your work, your abstracts, and mobilize your network to be part of this journey. Let us live here today energized, focused, and united in our conviction that Africa can lead the way in bridging science and policy for climate and health resilience. You have seen, even in the attached community, the just concluded WHO Global Conference, we are showing the way. We have, like for Kenya, our Kenya Climate Change and Health Strategy, the Ugandan Health National Adaptation Plan, the Nigerian Health National Adaptation Plans have been featured. We are also going to be featured on partnership. We are strong as Kenya because we cannot just say this, but we have also to really keep on working together and really appreciate all this. So together we can build a healthier, more sustainable, and more just future for all. And thank you, and we look forward to welcoming you to Nairobi in October 21 to 24. And we even welcome you to stay longer because we just have the Nairobi National Park next to Ole Sereni. Thank you, and wishing you all the best. Asante sana.
All right. Thank you, Mr. Lokolile, a great brand ambassador for the country, but really welcoming us all to the Pan-African Conference. I have been your lead moderator, Leah Aoko Otieno, and it's now my pleasure to invite our media team to take a photo just for evidence purposes. I'm aware that majority of us may not be able to turn on our videos, and that's okay. We'll still have snippets of attendees, but for the panelists who are able to put on their video, kindly put on your video so that we can have a bit of evidence. Yes, a few of us. Yes, please go ahead, continue putting on your video so that we can
Professor Songo gives his apology, but I'll hold both hats. Thank you.
Asante sana. That is well noted, John. Let's continue to put on our videos. Media team, I hope you are at hand. Please give us a thumbs up if you've already.
Thank you very much, Leah. Thank you. And another huge thanks to all the speakers, participants, and colleagues for making today's such an insightful and inspiring one. And before we even take that photograph, I just want to encourage those who have not registered to just do so and also submit their abstracts. This is a good space, not just for sharing knowledge, but for shaping practical solutions at the intersection of environment, climate change, and health. And of course, we are not forgetting evidence and science. So now, before we close, let's capture the shared moment. Kindly turn on your cameras and smile for a quick virtual group photo. I hope your cameras are on. I can only see Leah smiling. What are the rest doing? Are you grinning? Okay. One. Okay, this is done. Thank you very much. We look forward to the next webinar. Thank you.
Well, hey,
Thank you.
bye. Au revoir.
Bye-bye.
Mudachi.
Bye. Bye.
Bye, everybody.